For Chapter 7, we're going to go through depressants and inhalants. I'm going to go through this pretty quickly, so use your textbook. Make sure you read this stuff. There's a lot more information than what I'm going to cover here. So depressants are the most widely used and abused drugs in the United States. Obviously alcohol is number one. You might not think of alcohol as a drug, but it sure is. So, like nicotine and alcohol are widely used, but here we're going to talk about alcohol. Alcohol relieves stress and anxiety. I bet you many of you in the class have had that experience where you're nervous about a date or something. You go out and you have a drink and it relieves anxiety. Bad choice for relieving stress and anxiety because it does nothing to fix the problem. Now, before we get into alcohol too much, we're going to talk about the drugs. The first category of drugs are called the barbiturates. Chloral hydrate was first synthesized in 1832, but really not used clinically until 1870 for sleep. Chloral hydrate is also called like a Mickey Fins. So that's been used throughout history. Like that's a street name. People would put that in people's drinks and it would knock them out. Paraldehyde was synthesized in 1829, but again not clinically used until the late 1800s. That stuff really has a bad odor. Bromides were used in the 19th century and until the 1960s. There's all sorts of drugs that have been used in the past as depressants, but really haven't stayed on the market. Like here's Milltown. Look that up if you're interested. So they're marketing it to pregnant women and for anxiety. Quaaludes are a drug that you might have heard of before. Methaqualone. This drug is illegal in the United States, but a depressant. This one was really quite powerful, and it didn't really have a hangover effect. This was really popular in the U.S. To use recreationally. There's Quaalude. You don't have to know these. I just want you to see how many barbiturates there are. Huge numbers of barbiturates. You've probably heard of like Nembutal, Seconal, drugs like that. A lot of celebrities overdosed on those. The benzodiazepines came into play in the United States because of that potential of overdose on the barbiturates. So, barbiturates can be lethal in overdose. Benzodiazepines, on the other hand, were marketed as safe in overdose. So if you take a bottle of a benzodiazepine, which would be like Xanax, Klonopin, Ativan, you're going to be in like a coma. You probably shouldn't do that while you're driving a car or like on a raft in a pool. But if you overdose and you're medically supervised, that should be safe. However, you mix that with alcohol and it's like that lights out. They can be really dangerous when mixed with alcohol. They're also really addictive. And once people become dependent on benzodiazepines, if they go through withdrawal, they can have seizures and it can actually be like fatal. So that it has to be medically supervised. These are good drugs used for short periods of time. They really do good at reducing anxiety levels. They work on GABA receptors, so they facilitate GABA binding. GABA is a universal inhibitory neurotransmitter. So what they do is they decrease central nervous system activity and diminish the brain's level of awareness. The symptoms that you're going to get are going to be a decrease in anxiety and sedation. There's lots of other drugs that can do that as well. The benzodiazepines can be used to treat seizures. So if somebody's having a seizure, an ambulance picks them up, they'll have Ativan on board and they'll inject them with Ativan. But also at the state hospital that I worked at, the psychiatric hospital, when patients would get agitated, they'd also give them a shot of Ativan. So the drugs in this category: barbiturates, barbiturate-like drugs, benzodiazepines, alcohol, antihistamines, Histamine is a neurotransmitter, but it's also involved in the allergy response. If you took a bunch of histamine, you would get anxious and nervous. An antihistamine makes you sedated. The best known antihistamine is diphenhydramine, or something that you probably know as Benadryl. Opioids like heroin or depressants as well. We'll talk about those later. GHB or gamma hydroxybutyrate, and then some other inhalants we'll talk about. So the benzodiazepines, we prescribe those for anxiety and sleep. Halcyon, you're not really going to see that too often in the United States. That was more marketed for sleep. But Xanax, Ativan, Valium, Klonopin. Valium used to be the most popular, now it's Xanax. So there's lots of different medicinal uses. Here's a chart. These are the drug names over here and the brand names over here. Most of these you probably never heard of. So it's just interesting to look at. Pause this if you want to look at these. Lots of benzodiazepines. Some are short acting, some are long acting. The short acting ones you want to take for sleep. The long acting ones are better as sedatives. Some of the other ones, like Rohypnol or Rufinol, people use that to drug other people because they have an impact on memory as well as sedation. And the weird thing is that sometimes people get really drowsy and tired, but other people will get really like agitated. So we call that a paradoxical effect. This is like a little old lady who's afraid to fly, and her granddaughter gives her a Xanax, and she gets on a plane, and then they go wild on the plane. Like they might strip down all their clothes and go nuts. So sometimes they don't work like they're supposed to in everybody, but that's pretty rare. There's Rohypnol right there. You might have seen that movie right there. Famous movie. This is a schematic diagramming the relative time course of 2 barbiturates and 2 benzodiazepines after administration. So you see, like, a rapid onset and rapid metabolism and excretion versus a slower onset and a longer metabolism and excretion phase. So like this would be Valium, and that would be better for anxiety, where this is secobarbital, which would be better for sleep. Low doses, again, versus high doses. You know what, the doses doesn't really matter. All the drugs have different potency, so you can't really compare doses like that. But you take a little bit, you're going to feel relief from anxiety. You take a lot, you might go to sleep. And at really high doses, we can even use it for like anesthesia and surgery. It's like what Michael Jackson did. Here's a picture of a spider. Why is this up here? Well, in therapy, a lot of times people have phobias, and you can't even work at treating the phobia. If you give somebody a benzodiazepine, like their anxiety will go away within like 15 minutes. There's lots of different inhalants. We don't go into too much detail here, but we'll cover these. They can cause all sorts of different negative effects, as well as the sedation, like nausea, sneezing, coughing, lightheadedness, but they can really do some damage to your heart, kidney, and brain. Big problem is hypoxia. It means lack of oxygen. So a lot of times people will do inhalants and they'll stop breathing. The nitrites are drugs that let's see. I mean, really, a lot of people use these to enhance sex. Like they're called amyl nitrates, and they get into the brain really quickly They drop blood pressure really fast. They have an unpleasant smell. But they also like relax smooth muscle tissue. It's kind of weird. Solvents, we'll talk about those, and GHB. GHB was popular when I was in college, and here you can see the GHB medical emergencies from 1992 to 1999. This is from the Drug Abuse Warning Network. I know this is kind of outdated, but you could see the rapid rise in GHB use in the late 90s. GHB you can make in your bathtub. A lot of people that are concerned about like calories will do GHB instead of drinking alcohol. The effects are very, very similar to alcohol, but if you have like a couple little tiny capfuls of GHB, it can be equivalent to drinking like 20 drinks. So, dangerous drug. Here's some GHB bottles. This is not like ecstasy. This is just labeling here. You used to be able to buy these kits and you could make the GHB in your bathtub. So it's a sedative and it can be used as a sleep aid. The weird thing is it's also a treatment for narcolepsy, but it's a recreational intoxicant. If you take this, I mean, it can put you into a coma and it can kill you. These are the volatile solvents. A lot of times they call these poppers. So some of these are like the nitrates or nitrites, like amyl nitrate. These are kind of weird drugs. They're inhalants. You just hit them. A lot of times they're called like locker room. They're like room deodorizers. They'll sell them as room deodorizers, but people know what to do with them, and they have a history of being popular in the gay community. All sorts of different aerosols. I mean, we're not even going to go into detail there, but they can really be intoxicating. Here's an old like lithograph of somebody doing nitrous oxide. Nitrous oxide's been around for a long time. You can get that like a Ready Whip in the grocery store in a whipped cream container. Or you can go buy these nitrous oxide charges. You put them in this thing here. It's called a cracker, and you collect the gas in this balloon. They also use that in cars because it's it can boost the horsepower of a car. They use it in surgery. You've probably had nitrous oxide at the dentist's office. I mean, you're not really going to have any problems with nitrous oxide, but I mean, people die from that because they'll put like a trash bag around their head and put the nitrous oxide in there, and they don't breathe oxygen. So inhalants can cause sudden death. That's kind of scary. They can cause a lot of brain damage, liver damage, kidney damage, heart damage. They can damage a fetus, and there's lots of accidents associated with being intoxicated on inhalants. I think somebody in the class posted something about this, but I had some friends in high school that were doing this product called Dust Off, and these girls were driving while they were inhaling it. The girl, after she inhaled the dust off, went sailing off the road and almost killed these two girls. So I mean, they are really impairing. So you know, it's not uncommon that somebody will die from that sudden solvent death syndrome. So that's a quick and dirty with the inhalants. I mean, there's a lot more to that. Depressants, we didn't really go into alcohol too much. Alcohol works on lots of different neurotransmitter systems. All the inhalants can be kind of dangerous, especially the benzodiazepines when you combine them with alcohol. Alcohol alone can be very deadly, so you should probably stay away from these things.